may I invite Dr. Ravi Singh. And Ravi Singh is known for his pioneering work in the field for Sahaini effect, a revolutionary technique of medicine transmission through hair. His clinical innovations, dedication in research, and commitment to classical homeopathy have made him a respected figure in both in India and internationally. So the topic is, can homeopathy replace surgery? Real-time clinical evidence. So once again, sir, please, yes, sir. 15 minutes time is allotted for you, sir. Kindly cooperate with us. Thank you, sir.
Thank you, International Forum for Promoting Homeopathy, to provide me this opportunity to present my work at the land of Kerala. I am fortunate and I'm privileged that I have delivered many webinars to this Guinness record holder. I am predicting this as a Guinness record holder, International Forum. And today I am going to present before you some very unique cases. So my favorite topic is, hello, it's not working. Yes. My favorite quote is, to study the phenomena of disease without books is to sail in uncharted sea, while to study the phenomena of disease without patient is not like going in the sea at all. Why am I stressing this point? Because most of the time I am seeing the case presentation in our college and in the books without the patient, without the evidence. So I am presenting the cases before you with the evidence. Every time I need to come here. So these are the cases I am going to present before you. So these are the cases of CSF rhinorrhea, Hirschsprung disease, Burger's disease, chyluria, intussusception, appendicitis, fistula in ano, large abscess. The topic was, can homeopathy replace surgery? Yes, if you can treat such cases, you can definitely replace surgery. These are the cases which I am going to present before you. Few of the cases. This is a case of hemangioma, large hemangioma. If you can see the disease condition, the first picture, second picture, third picture, fourth picture. You can see this is a case cured by the transmission of calcarea floor. Now coming to the another case, this is another case of hemangioma. You can see. Now coming to the third case, it is a case of large abscess. You can see the size of the abscess, which was cured by the transmission of calcarea sulf 0/1. I am coming to the detailed of the cases, few of the cases. So this is a case you might have seen in your practice. This condition is called as pyogenic granuloma. You can see the fingers, the pyogenic granuloma, and you can see the difference in the condition. This case got cured by the Thuja 0/3 transmission. Coming to the next case, this is a case cured by the acid nitric. This is another case of pyogenic granuloma. Now coming to the next case, this condition is called as cephalhematoma. When the child passes through the birth canal, sometimes due to obstructed labor, there is a hemorrhage in the skull, and that takes the shape of the skull that causes the cephalhematoma. This was the condition, and I have treated this particular child at my clinic, and she got cured. This is the rubric. I treated her with the silesia, and this case came to my clinic after 50 long years. Now you can see how this same child got cured.
कितने साल की हो गई ये लड़की अभी है?
The same child came to my clinic after 15 years.
15 साल पहले आई थी ना हमारे पास उस पुरानी वाले क्लिनिक में.
So these are the type of cases, surgical diseases you can cure at your clinic as well. Now coming to the next disease. This is a case called as Burger's disease. In the Burger's disease, this is a disease of smokers, where in our books it is clearly written, either you can have your limb or cigarette. You cannot have both. It is called as thromboangiitic obliterans. You can see the condition of the patient where there is ulceration, and this case got cured by the arsenic. Now this is the comparative photos. This case, surgical disease cured by the transmission of arsenic alb 0/1. Now coming to the next, this is the same case you can see. And coming to the next case, a very recent case. This is also a case of Burgers disease, when this patient was told by the surgeon that you cannot be cured without surgery. He need to cut the fingers. Now you can listen. This is the background of the case. Now
ये उंगली कब से आपका घाव हुआ है? ये हुआ है अभी 3 महीने हुआ।
अच्छा, 3-4
महीने पहले।
किस डॉक्टर ने कहा कि उंगली काटनी पड़ेगी? हार्ट वाले ने कहा।
The surgeon told that this can only be cured
ठीक है,
by
देखिए
amputation.
डिजीज तो खतरनाक ही है आपकी।
Now I have treated him and with the sulfur. I can explain these cases for 1 hour, but I have time constraint. I am trying to sum up the different disease condition where the surgery was the only option, and now sulfur transfusion was given, and you can see the difference. He was 60% better.
बोलिए केहर जी कैसे हैं?
He was 60% better. Now he got 100% cured. The fingers was saved. So this was the last condition of the patient. Now coming to the next condition. This is called as medical emergency. The case of intussusception. It was also clinically diagnosed, and it was also diagnosed in the report. You can see.
उन्होंने बोला था ये चीज कि इंटरसेप्शन हो गया है।
हाँ बोला था।
उन्होंने बोला इंटरसेप्शन
4 से 10 तारीख तक नीरा में हॉस्पिटलाइज रहे। जब 4 को सबसे बड़ा प्रॉब्लम आया, तो 10 को जब इन्होंने सिटी स्कैन कराया, उसके बाद इन्होंने रिफर।
Now you can see ileocecal intussusception. This was the report, the first report. You can see in the CCTV how the person was. This patient was in the agony, and I have transferred this medicine, sulfur.
पेशेंट से बात करा।
नमस्ते डॉक्टर। हाँ बात करा ये।
नमस्ते नमस्ते, कैसी हैं आप?
So I am only.
पहले से तो ठीक है।
Now this is the final.
कैसी हैं आप?
बहुत ठीक।
She got
बहुत
cured.
ठीक।
After this session.
आप बहुत खुश?
See the expression of the face.
पेट सब बढ़िया, दर्द की
पेट नहीं, दर्द नहीं होता डॉक्टर साहब।
मोटाए गए इनका बिच्चन कुछ?
खाएंगे मोटे तो होंगे, जब खाते नहीं थे तो दुबले थे, तो वेट भी तो बढ़ेगा।
वेट।
So this was the case, and in the comparative report from the same diagnostic center, intussusception was not there. From the Lucknow, this is the report. Now coming to the very severe disease condition. This condition is called as CSF rhinorrhea or cerebrospinal fluid rhinorrhea. You will not find such cases in your clinical practice. I am fortunate enough that I am getting such cases which was refused, that they cannot be cured without the endoscopic surgical repair. And I have hundreds of cases of CSF rhinorrhea from the different part of the country. These are the CSF leakage. In the next video you can see how the CSF brain fluid is getting to the nose. Can you see? The brain fluid is getting leaked to the nose. This is called CSF rhinorrhea or cerebrospinal fluid rhinorrhea. Different causes. I am going to explain all those things. So coming to the next video, these are the cases. You can see the dripping of brain fluid from the nose. This is a medical emergency, and most of the cases are treated with the endoscopic nasal repair. Sometimes the Diamox medicine is also prescribed. I have different type of cases from the brain tumor, from the spontaneous cause, from the head injury also. So these are the different cases, and all these cases are from my cases, and they got cured. I am going to present only few cases of this. This is a condition called as CSF rhinorrhea. The fluid which is running through the nose is accidentally leaking through the nose. There are the different causes: acquired and congenital cause, traumatic and non-traumatic cause. Any factor which increases the CSF pressure can cause the CSF leak. And I have seen in my clinical practice, mental stress is the one of the most important cause. Even COVID was a cause, because in the COVID condition there was frequent sneezing and coughing, and that has caused CSF leak through the many patients. So this was the cause. Diagnosis is made. Why I am telling all these things? Because you are not going to find such cases. Even you can miss such cases in your clinic, assuming that it is general coryza. The nose is dripping with the coryza. No, it's not coryza. The chemical diagnosis is the beta transferrin, a very specific protein found in this particular fluid. Another is the CT system. Normal CT scan and MRI miss this diagnosis. There is a specific test called as CT cysternography, unilateral discharge without coryza, and one home diagnosis is also there. If the patient is getting leak and they are taking that fluid in the handkerchief and handkerchief is not getting stiff, that means it is CSF rhinorrhea. Because in the nasal fluid, there is a mucin content that making the handkerchief stiff. But in the cases of CSF rhinorrhea, handkerchief will never get stiff. So these are the cause management is the surgical endoscopic nasal repair, and obviously I am treating all these patients with homeopathy. This is the rubric, because you can see head cannot expand after the fusion of the sutures. So this is the most important rubric. In case of spontaneous leak I am taking. In the injury case you can take the rubric head injury. So this is the first case, you can see. Follow up through the case of CSF rhinorrhea, bony defect in the cribriform plate, and this case got treated and there is no bony defect. That is CSF rhinorrhea, my first case. And now coming to the next case.
Patient कौन है?
Case from the Bengaluru itself. She
Hello?
got treated.
हाँ जी बोलिए, मैं सुन रहा हूँ.
The first consultation, online patient, she sent her hair from the
इनको
Bangalore.
CSF राइनोरिया हो गए हैं
और 2 साल से CSF राइनोरिया है.
जी
कम हो गया था.
अभी कम हो गया.
Now, see, these are the reports, the specific protein 119. Coming to the remedy, this was the natramur. I have started transported.
बोलिए, नुसरत जी.
जी हाँ, आज सुबह से बहुत खांसी शुरू हो गई है.
अच्छा, बाकी आपका.
Now,
Hello.
to the next follow-up.
कैसी
And
हैं आप?
This is the final follow-up, and the patient got
हाँ,
cured.
मेरा तो CSF बहुत अच्छा है अभी.
Coming to the other case, this is a patient from the Lucknow itself, and she came to my clinic, and you can, what happened? Yes, you can see the CSF was getting leaked through the nose. You can see at that particular place. Laser is not working. You can see this CSF is leaking, and now I have transferred Silesia
Hello.
from my center. This is the first.
मोनिका जी कैसी हैं आप?
नमस्ते सर.
नमस्ते. कैसी हैं?
मैं ठीक हूँ.
60%
आपका
reduction in the
जी
CSF.
ठीक हूँ मैं.
CSF में कितना फर्क पड़ा आपको?
60% फर्क पड़ा है.
60% got
60%.
reduced. In the next follow-up, you can see
बोलिए.
100% cured.
बहुत बड़ा सा लंबा तिलक लग रहा है.
Language is only Hindi because I am
नमस्ते
from
सर.
कैसी हैं मोनिका आप?
These are the final report, and she got cured. Now coming to the other case of CSF rhinorrhea, if you can see, there is a one bony defect of size 6.5
अभी आप आगे
mm.
तरफ झुकेंगे तो आएगा पानी?
6.5 mm.
जी सर.
Bony defect
दिखाइए.
in the brain.
अरे तो बहुत ज्यादा आ रहा है. अब इस कंडीशन में आपको बिना सर्जरी के कोई भी डॉक्टर नहीं बोलेगा.
Now coming to the rubrics, these are the rubrics: hydrocephalus, leukocyte element from Boster. These are the rubrics I have taken, and Naxomka was transported, and
हाँ सर.
no CSF leak after.
कैसा है CSF लीक आपका?
This is a very recent case. And,
कुमार कैसे हैं आप? कैसे हैं आप?
this is complete recovery, and I have paused his treatment. And in the recent report, the 6.5 mm defect in the brain got cured. With the recent report, bony cribriform plates appear normal. So it's not only cured clinically but also pathologically. Another case of left ventricle failure. You can see 35% ejection fraction was there, and
खत्म हुआ है. नहीं कुछ ज्यादा खत्म नहीं हुआ, थोड़ा सा आपका हार्ट में थोड़ा सा प्रॉब्लम है. हाँ.
and I have treated this particular patient. Left ventricular failure, ejection fraction was only 35% with the lachesis transition, and the final report you can see ejection fraction was 65%. The LED is not much clear, so
भाई 2-3 महीने में कैसे
नहीं, जिन डॉक्टरों को आपने पहली रिपोर्ट और बाद की रिपोर्ट दिखाया उन्होंने क्या कहा?
treating doctor was amazed that how homeopathy can cure such disorders with the. Now coming to the next disease, this is a disease which you might have never seen in your clinical practice, and I am fortunate that I have lots of cases. I have treated more than 15 or 20 cases of this disease condition. This disease condition is called as Hirschsprung's disease. It is one of the cause where congenital, it is also called as congenital megacolon. When the rectum, the last part of the rectum, there is no ganglia. So there is no penetrating motion and the child passes the stool late, sometimes initially and sometimes in the later session. So this is the congenital megacolon, the disease condition. Surgery is performed. These are my real patients. You can see the abdominal girth of my patients. These are the called, even the surgery is performed in this particular 2 patients, and later the problem was not resolved and I have treated and they got cured. Not only with them, this is the case which I have presented in earlier seminars, so I am only presenting the report. In the first report from the same center, Hirschsprung disease, and in the next report there is no suggestion of Hirschsprung disease and the case got treated with the transmission of anacardium 0/1. Coming to the next case.
हुआ इनको Hirschsprung disease आपका diagnosis?
ये तो फिर डायग्नोसिस हुआ है जनवरी में आपकी बार।
जनवरी में
ट्रीटमेंट तो इसका चल रहा है 6 महीने की जब ये हुई थी तब फिर ट्रीटमेंट चल रहा है।
तो तब तक कोई जान ही नहीं पाता कि क्या प्रॉब्लम है इसको, बस कब्ज की दवाई देते रहते हैं।
A case, this case was, the child was got treated with the medicine Platina. Can you see? Platina was coming in the child's case. Usually we will always see Platina in the cases of females, beautiful females who are egoistic. No, child can also be Platina. So this was the case.
नमस्कार।
Better passing is
अनाया कैसी हैं आप?
Barium enema X-ray and barium enema. Now she got normal. Another disease condition, this condition is called as blepharospasm. Why I am calling this condition as a condition of surgery? Because in some cases surgery is required, blepharoplasty that is called as. These are the condition when the eyes got blinking, severe spasmodic closure, and this is a case, a very recent case. You can see the child.
मैं कोई भी धार नहीं छोड़ा हूँ लखनऊ भर में।
चलिए होम्योपैथी में आइए, होम्योपैथिक शरण में आइए तो ठीक होगा।
And came to homeopathy. Calcarea was selected and now
बताना बड़ा कठिन हो जाता है। कैसे हो आप? एकदम बढ़िया, आँख सब।
and this is the final one. On the 11th September only.
किसी तरह का कोई ब्लिंकिंग नहीं होता है।
There is no blinking. This is the calcarea. Another case of this blepharospasm. This was my first case. So why I am showing this particular case? Because this case came to my clinic after almost 8 years to thank me. So
कैसे रहे आप?
this is after 8 years he came to
ब्लेफरोस्पाज्म के मेरे पहले केस थे। आपके पहले मैंने कोई केस नहीं देखा था। ब्लेफरोस्पाज्म 1-2 केस हमने बलरामपुर में।
Another my last presentation, that is a disease condition called as chyluria or milky urine. You also not get frequent cases of chyluria or milky urine disease. This is mostly caused due to the filaria condition, and you can see this is the urine sample of the patient. These are the patient's condition. The patient came with this particular color of the urine, showing this is the color of the urine. Sometimes urine getting obstructed due to the chyluria. It is fat related diet, and I have transferred Matramure and he got cured. So this was my short presentation. So what are the cases you have seen? I have tried to sum up in the very limited time such cases. Any of these all cases not received any oral medicine. I am treating all my patients with somewhat very different procedure. That method is called as medicine energy transition. It is advanced form of homeopathy. It comes under the domain of homeopathy, in which we select a proper homeopathic medicine for that. And in this particular methodology, we take that particular medicine in a glass vial like this at our center, and one of the hair of the patient is getting inserted in this particular vial, and the patient are treated remotely without eating any medicine. So these are the few of the cases. All these cases are present at my website. These are the different benefits of this particular methods. You can click this picture. So there is a QR. You can scan my website, and there are all these cases which I have presented here are already present at my website. There are more than 1,000 cases, documented cases at my website with our video, with the photo, with the reports. So thanks International Forum from promoting homeopathy to provide me opportunity to speak before this August gathering. Thank you.
Thank you, sir.